Something that we've known for a while here in the US is that our for-profit healthcare system, due to its nature in being for-profit, costs us substantially more than any other country that guarantees universal healthcare to all its people. And this is just further example of that. This is from Common Dreams. I'll link it down below. Seems like a good idea. CBO, Congressional Budget Office, shows Medicare for All could cover everyone for $650 billion per less, or $650 billion less per year. That is a massive amount of money that would be saved, and everybody would be covered. No worrying about deductibles, premiums, co-pays, whether this provider or that provider is in-network or out-of-network. You could go see whatever doctor you wanted. It would all be covered. You wouldn't have to worry about any of those fees or anything. And again, the only reason we don't have universal health care in the United States is because of the power of the for-profit health insurance companies, the pharmaceutical industries, for-profit hospitals, HMOs, etc. Because again, it saves lives. It would save tens of thousands of lives a year in the United States. We wouldn't having the ridiculous thing where people go bankrupt because of medical debt. That would all be washed away. Everybody would be covered. We'd be saving money, lives. There'd be no more medical bankruptcies. And the only reason this hasn't been implemented is because a lot of the politicians are in these pockets of these for-profit health insurance companies in the pharmaceutical industry. Let's see. In its analysis, the CBO looked at several distinct single-payer designs and determined that for such systems, fully implemented by 2030, would save anywhere between $42 billion to $743 billion that year alone. That is for 1 year. And again, at that higher end, that is the equivalent of the NDAA or the military budget, basically, which is just insane. And everybody would be covered. I mean, again, we're in a pandemic right now. Tens of millions of people have lost their employer, their health care that they had through their job. And guess what? In this system, everybody would be covered. You lose your job, you still have fucking health insurance. Like, it obviously should be treated as a human right, healthcare that is, along with housing and all these other things. But it's not in the U.S., and we pay more than any other country in the world for our healthcare expenditures, and we have all these horrible outcomes because it is for profit. It is not for what's in the best interest of people's health, their pocketbooks, or their lives. Bruning explained that the CBO option, this Matt Bruning, the most closely resembles current Medicare for All proposals, is the one based on low payment rates and low cost sharing, which should generate $650 billion in savings in 2030. That is a massive amount of money that could be given back to the people, put that back in their pockets to do what they see fit with. It can be invested in other programs, the social uplift, housing, jobs, Green New Deal, whatever. But that it would be a huge amount of money that would no longer be padding, the stocks of these health insurance companies and pharmaceutical companies. If one were to add long-term support and services the option, as many current Medicare for All proposals do, savings would fall to about $300 billion. Even still $300 billion savings is insane amount of money, and just really again shows the power of these lobbying groups and how a good chunk of politicians, especially Republicans, but a lot of corporate Democrats as well, totally bought and paid for by these same interests who don't want you to have health care because it would cut into their corporate profits. And that's obviously disgusting, putting, again, money before people's lives. Very typical of what you would see in a capitalist system, such as we have here in the U.S. to the nth degree. Because a lot of other countries who have it, obviously capitalist as well, just the United States is, very, very extreme in that sense. Let's see. Overall, continued the study confirms what serious medical fraud analysts have known for some time now. It is possible to provide high-quality public health insurance to every person in this country while also saving money overall on health spending. Bruning added that the barriers to the policy are not technical deficiencies or costs, but rather political opposition for Republicans and conservative Democrats who would rather spend more money to provide less health care. Boom. Couldn't have said it any better. He's also a pretty good follow on Twitter as well. So that's it. Again, we already knew that Medicare for all saves money, saves lives, but it cuts into these for-profit health insurance companies and pharmaceutical companies' bottom lines. That's why we don't have it in the U.S. Vast majority of voters support it overall. 80-90% of Democratic voters support it, and I think when the concept is actually explained thoughtfully and concisely to people, I think that number would shoot up even more. So just really a travesty on all levels that we don't have universal health care in the U.S., especially during a pandemic. Peace. Much love.